right. Good afternoon and welcome everyone. Good morning to those of you joining us from the West Coast or farther out, our friends in Alaska or Hawaii, if you are with us. We are delighted to have you all with us here today. I'm Amanda Berkson-Shokak, a senior fellow here at National Skills Coalition. We have a really robust conversation lined up for you today with three absolutely brilliant women, and I could not be more delighted to have the pleasure of moderating this conversation. So just to give you a little bit of background and how the flow is going to go here, I'm just going to spend about the next 5 to 7 minutes giving a bit of a quick overview of our recent report and the genesis of that and the kind of big picture of these issues. Then we're going to spend about a half an hour hearing from our three panelists, who I will introduce to you shortly, um, and really talking about what they bring into this conversation, the expertise that they have to offer. And then we have 15 minutes at the end for you all to share your questions. Please feel free to drop your questions into the Q&A box as we go through. If we don't have time to answer a question during the webinar today, but it is one of specific interest, I will also try to make sure that we answer it in the follow-up. We will, of course, be making both the slides and the recording from today's webinar broadly available, so you will get an email following the webinar a day or two afterwards with the recording and the slides, and you are welcome and encouraged to share that with your friends and colleagues as you see fit. Again, delighted to have you all with us. I'm Amanda from National Skills Coalition. I'm going to go ahead and share my slides now and walk us through just a quick opening bit of context. And it's going to take me about 5 seconds to get the full screen version of these slides open because my screen always wants to default to presenter view. So just give me a couple seconds grace here. Okay. So you are here today, I hope, because you are a workforce or education advocate and you took to heart our call that this is a moment for workforce and education advocates to join with our colleagues in the direct care workforce field and the early care and education workforce field to really speak out about care workforce development issues. We are appreciative that you're here. We realize that some of you may have been in this conversation for a minute now, so we're not meaning to sort of Columbus our way into discovering something that has been there for a long while already. But we know that for others of you, this may be a newer area for you to think about or concentrate on, and there may have been good reasons that you, as a workforce or education leader, have not necessarily been able to focus on this issue in the past. So as I said, we're going to do a little welcome and overview here. I'm going to talk for about 5, 7 minutes. We're going to spend about a half hour with our amazing panelists, and then we're going to go into a Q&A with all of you. Many of you are here because you read our recent report, Making Care Jobs Good Jobs. That report is linked on the slides here, and my colleague Tiana has or will soon be sharing it in the chat so that folks have it to access. I'm not going to recap the entire report here today, but I am going to highlight some of the big takeaways that we hope folks will have from it. National Skills Coalition developed the report and we take responsibility for its recommendations, but we also wholeheartedly thank our Care Workforce Advisory Council, two of the members of which are here on the webinar today, for the insight that they offered in developing these ideas. And I'm going to be very real with you. We went into this project thinking that we might be developing recommendations for care workforce advocates. And then we had a little bit of an aha moment at the first meeting of our advisory council where we got some folks saying, you know, care workforce advocates have been working on these issues for a long time. And there are some really well-developed and well thought out and stress tested ideas and recommendations. What we most need National Skills Coalition to do is to bring other folks into this conversation. And so that is part of what we are doing here today. So the members of our Care Workforce Advisory Council are listed here and on the following slide. Some of you will know some of these folks because they are pretty eminent in their states and nationally. For some of you, these may be new names, and I encourage you to connect with folks on our advisory council as you see fit. I have highlighted here the two, or bolded rather, the two names advisory council members who are joining us today as panelists, including Nicole Howell, who is the Director of Direct Care Workforce Development at the National Council on Aging, and Kezia Scales, Vice President of Research and Evaluation at PHI. We're also joined by the amazing Professor Ana de Hoyos O'Connor, and we are just delighted. So, who are care workers? I keep throwing around this term. What do we mean by that? We have some stats in our report, which I've put on the slide here, but I think the major takeaway is that care workers are the people who provide care for children, for elders, and for people with disabilities of all ages, often in home and community-based settings, sometimes in uh, center-based or more institutional settings. This workforce is overwhelmingly women. It is heavily people of color. It is heavily immigrant. Many workers live on very low wages, as you can see by the indicators on the last two lines of the slide here of folks who are receiving public assistance, such as TANF or SNAP, despite working in care industry jobs. And some folks are actually below the poverty line, which those of you who have worked at all in workforce development know is very low in the United States. So to be below an already low line is really an indicator of the wage levels that a lot of care workers must contend with. There's a lot of reasons behind those wages, and we'll talk about that in a minute, but I think it's helpful to ground ourselves in the reality of who's doing this work. And many of you have heard the saying, but you're going to hear it several times today. Care work is the work that makes all other work possible. Right? Some of you know my own story of having helped care for a terminally ill friend. I could not have done my own job in the 10 months that I was caring for her if home workers were not available to provide care to support her, right? So care work is truly the work that makes other work possible. So why is now the right time for workforce leaders to join the care workforce conversation? Um, First and foremost, because we are in a moment of, frankly, even more fragility than normal for a field that already deals with enormous stressors, right? Um, uh, Issues in SNAP benefit cuts and Medicaid funding issues, changes to the ACA. These are all big picture contextual issues, immigration enforcement, that are affecting both the people who receive care, the people who depend on care workers in order for them to be able to work, which are sometimes the same people, right? Because folks with disabilities may depend on care so that they themselves can work. Um, and the rest of the economy and businesses that may not think of care work as their bread and butter, but are deeply affected if a child care center closes or if a nursing home loses a chunk of its workforce. Right. And so this is a moment in which more voices are needed to join this conversation from different angles. And I hope in the next couple of slides, as I quickly highlight a handful of our recommendations, that you'll see that we're not expecting that any one of you on today's call try to tackle all of these recommendations. We're hoping that you're going to pick one or two that really resonate with you and use that as your entry point into these conversations. So our first set of recommendations are mostly revenue neutral and are directed at practice. So if you are a workforce board leader, a nonprofit administrator who's running a workforce program, an adult education program director, career technical education, you can include care workers as part of your strategy process. If you have a board of directors, consider inviting a care worker to join the board. If you are running an advisory council, consider inviting a care worker to join there. As our report makes clear, we do advocate fair reimbursement for folks via honorarium, travel costs, etc. If you are asking this additional work of them, because we don't want to compound the low pay issues in the field with then also asking people to do unpaid work. Um, Convening partners to facilitate collaboration and to improve career pathways into care jobs. Many of you on this call today are already conveners in your community. As a community college leader, as a nonprofit like a United Way or a Goodwill, you can play that convening role. And we have more specifics about that recommendation in our report. You can also take a look at the data that your organization has already collected, right? If you are a One Stop or American Job Center, you may know the job that people were working in most recently before they came to you, right? Why did they leave that job? What's going on in that field? How can we better understand both why people are leaving the care workforce field and what can help them stay? These are not new questions. Lots of people have asked these questions before, but you may have different data than some of the people who've asked this question before. And so combining your data with that conversation can be powerful. Engaging with state agency leaders, particularly in early care and education, but also in other parts of the healthcare sector, and then gathering input from care workers themselves about how digital tools and technology are shaping their training and employment experiences. So you're going to notice that most of the practice recommendations here don't require you to spend significant amounts of money or even any money, right? These are things you can do now that don't require finding additional large new grant sums. And of course, those are always lovely, but we wanted to give you some very practical things that don't require that. But we also want to talk about policies. And again, I'm giving a quick gloss here. There's much more detail in the report, but I want to make sure we get to our amazing panelists. So when we talk about the policies, first and foremost is advocating for increased reimbursement rates for care workers, right? And again, I'm going to be very real here. Families are at the edge of what they can afford, right? These programs need public investment, whether that comes through the Child Care Development Block funding, whether that comes through Medicare and Medicaid, whatever public sources it comes from. Advocating for increased reimbursement rates is crucial because, as the saying goes, you can't get blood from a turnip, right? You can't squeeze something out of something that isn't there to begin with. And we don't want to put people in the position of robbing Peter to pay Paul, right? We don't want to ask small childcare center owners who are operating their own childcare center to take smaller margins because they're paying their workers fairly. We want them to have the revenue they need to both pay themselves and their workers fairly. Um, supporting the modernization of training requirements. That's a complex issue. I'm not going to try to synthesize it here. If your state is having conversations about establishing quality frameworks for short-term or non-degree credentials, this is a great time to open a conversation about care workforce issues, right? Some states have said we want to create a category called high social value occupations, where we think the occupation is important even if it doesn't pay well. How do we balance, right, the need to invest in occupations that we desperately need as a society with the need to make sure that people are getting equitable and appropriate pay? Encouraging the creation of new on-ramps into the care workforce, particularly for those of you who are on this call in adult education and career technical education. Using discretionary funds, whether through WIOA or others, to thoughtfully incentivize employers to strengthen care job quality. Some of you know California's High Road Training Partnership as one example of this. Taking advantage of flexibility in federal funding to run demonstration projects that can improve workers' economic stability. There have been local versions of this in DC with child care workers' wages. There's some great research out from, I think, the Urban Institute on that project. and then participating in research that documents the ROI of care workforce strategies. Now, I've just sort of blitzed through this information. I'm not trying to give you a deep grounding in each recommendation because I really do want to get to conversations with our panelists here. So I'm going to go ahead and stop sharing. And we're going to open up to a more conversational format here. And again, I'll remind folks, please feel free to drop your questions into the Q&A box as we go here. We are delighted to have a good chunk of time at the end of today's webinar for answering those questions. So, Kezia, I want to start with you. You've often said nobody can go to work unless they have the elder care or child care services they need for their loved ones. Can you talk about why it's so important for general workforce development leaders to be part of this care workforce conversation?
Yes, absolutely. And I do just want to start by saying thank you for the opportunity to serve on NSC's Care Workforce Advisory Council and to join today's webinar. It's really great to be part of this conversation with everybody gathered here on this call. And I am happy to share why I think it's important for workforce development leaders to focus on the care workforce. And I would actually like to offer two reasons, one of which you alluded to. But the first is that the care workforce is the largest workforce in our country across all industries. And the direct care workforce alone represents the largest occupational group in the United States at about 5.4 million formally recognized jobs. And then the early care and education workforce adds another million jobs. And looking ahead, this workforce is expected to add more new jobs than any other occupation as well. On the direct care workforce side, we're looking at over 772,000 new jobs that are expected in the next decade, given the growing demand for the services that this workforce provides. So this workforce can't not be on the agenda for workforce development leaders. And then, of course, these 6.5 million and counting paid care workers are directly supporting every day our babies and our children and our other family members and loved ones, and in many cases, ourselves. And that leads into the second reason, which is that this workforce is foundational to the functioning of the rest of the labor force and thus our economy overall. And you've already spoken to this a little bit, Amanda, but a productive workforce relies on the availability of childcare and long-term care services. And without these services in place, parents and other family caregivers have to cut back their hours or take leave or forego promotion opportunities or even leave their jobs or exit the labor force altogether. And others who rely personally on caregiving supports may not be able to pursue educational and employment opportunities either. And to take that real quick to a meta level, among those who rely on care workers are millions of care workers who themselves have childcare and long-term care service needs. And if those needs aren't met by sufficient supply of appropriately trained, compensated, and supported workers, then they won't be able to go to work either, and the crisis compounds. So we really need workforce development expertise and leadership in the mix here.
Thanks so much, Kezia. And I so appreciate your point about scale, right? A lot of us focus also in the workforce field on infrastructure jobs. That's really important. You can read reams of information on National Skills Coalition website about infrastructure jobs. Just as a point of reference, I will say there are 40,000 coal industry jobs in the United States. There are 6 million plus care workers, right? The scale is really notable. Anna, I want to come to you now. You're a longtime early childhood education advocate with an eminent background. You're quite involved with your local workforce development system. You actually sit on your local workforce development board. Can you tell us what is your role on the workforce board and how did it come to be that you're sitting in that role?
So again, Amanda and everyone, thank you for the opportunity to be here. So I want to stand back and not apologize for what I'm going to say, but it took mentors for me. So I want to thank Amanda for reminding all of us that teachers like myself are in the classroom. So I came through the ranks of a toddler teacher, preschool teacher, ECI, Head Start, and still teach and visiting centers. So I want to remind everybody that's here. I started taking notes. We've got directors, we've got leaders on this call. It is a mentor that helped me. And so a mentor helped me become an advocate because we're in the classroom and we are using our weekends to set up our classrooms. And then you want me to do what? Yeah, I can't be there. So if you're not paying these directors or teachers and we're not making a living wage, it's kind of hard to get engaged. So I'm challenging everyone that's on this call. Who are you mentoring right now? My mentor right now on the workforce is our executive, Mr. Lopez, Adrian. So I was on the committee, very fortunate to be on this committee, and then was approached to be the chair. So I am the chair of the early care committee for our local Alamo Workforce Solutions here in San Antonio workforce. But I want to take us back, and I want to remind everyone that's on this call is to be an advocate, we need to be connected. And so in being connected, it's staying connected with leaders like all of you that are on this webinar right now. And so I want to challenge you, are you working with a day home provider, a teacher, a director owner, a Head Start person, and walking them through what's happening, catching us up? When Amanda sent me the information, I tore it up. I read this and took notes on it. And what it really reminded me of is we've got to be connected and we need someone to help us out. And I've been very fortunate to have someone do that. I am a first generation, and so I did not have this at home. My father was military, but I did not see someone volunteering. My mom and dad told us to go to work. So really sitting down with people in your community and finding out what do you do? We need your voice. And then I want to challenge all of us on something else. When I miss meetings, it's because I'm teaching. When I miss items, it's because I can't afford to be there. I'd love to go to national conferences. That takes funding. And so I want to encourage and challenge all of you to say to yourself, who can I mentor? And not a one and done. Who can I hold their hand and take me through it? I give credit to people that mentored me, and then I learned to attach myself to people. So when we're walking into a meeting, I sit down with the person who's leading our workforce board. These are the questions I want to ask. Okay, ask him this way. Because one of the things that I've learned is we've got to have we have to ask the same ask. And my ask usually was for teachers, we need supplies, we need outdoor stuff, because that was my soul, right? And it still is. And so sitting down with leaders and them teaching me constantly, in order for us to be engaged, we need to have one voice. What's the voice we're going to have? And that's the ask. Now, and I don't want you to not ask for the wages and the supplies, but ask that. So my role right now is a chair, and I want to, and they're amazing with me. I give them my schedule of when I'm teaching. They work around my schedule. We do Zooms at times, and I go to meetings. But there's many meetings that I also miss because I'm teaching. So for everyone that's on this call right now, that's my challenge to you. We got about 100. We have 134 people here. Who can you hold? Whose hand can you hold? So I had great people holding my hand and still holding my hand so that they can hear from me, hey, I want to be there, but there's no budget for us to be there. Or I want to do this, but there's not that. Or providing me the information that's there. So that's my challenge to all of you, unapologetic about it, and knowing that all of you as leaders can do that and help someone like myself be part of conversations.
I love that. What a beautiful illustration of lifting as we climb. Just so lovely. Nicole, many workforce leaders kind of struggle with how do we support care workers in building more skills, given that we know that sometimes increased skills don't necessarily connect to higher wages. There's a lot of facets to this issue. It's very complex. I want to focus on one in particular that you raised in our prep call that I thought was particularly insightful. Can you talk about how you see EMTs as a possible model for care workers to be promoted into senior roles, providing training to others?
Well, first of all, Amanda, I just want to say thank you. It's been an honor to serve on the Care Workforce Advisory Council, and I appreciate NSC's leadership in this area, sort of seeking to combine sectors and find commonality, which maybe previously haven't been seen. I think that is the kind of sort of entrepreneurial, like policy innovation that we're going to see really help all of us advance the workforce broadly speaking, but increase wages and support folks who are working hard out there. Now, as it relates to EMTs, they are part of what are called allied health professionals, which are so many of the people who make up our care system and medical system in the United States. They are those folks who are not necessarily degreed, but they do have some sort of training and a certification, like a certified nurse aide, a medical assistant, a phlebotomist. That includes EMTs. And the reason this came to my mind is during the acute stage of the pandemic, I worked around long-term care. And what would happen is if a county had a facility, a skilled nursing facility, had reached sort of a critical juncture of staff not being available, they would send in local emergency medical technicians in to support that workforce to ensure that the residents could continue to live there and that the infection controls could be followed and that the care was going to continue. And that was really critical on a Friday evening when there were no CNAs who were scheduled for that weekend. And what I learned through that process is EMTs are also allied health professionals. And so they are actually trained by other seasoned or more longer tenure in the field emergency medical technicians. That is not like direct care workers, in this case, particularly certified nurse aides, whose training is administered by, generally speaking, a nurse who has been in the field for a period of time, has completed certain training, and the program director that actually has to be a registered nurse that has been a supervisor in a long-term care setting. And those are really challenging to come by because nurses are rightfully command a strong compensation level. And for a training program to be able to get someone who meets those credentials who can fill in that way is really a gap. And I think that in the same way that NSC is looking to knit different sectors together, we should be looking at what can we learn from other sectors. And I would love to see direct care workers who have been in this field for an extended period of time, permitted to complete maybe a training on adult learning and adult education, because they are already training their colleagues anyway, and receive credit and compensation for that skill and expertise to train those direct care workers. You know, it feels very odd to me. I am not a teacher, so I would never presume to say, hey, Anna, I'm going to train teachers, right? I don't know what I'm doing. And so why are we doing that in the direct care workforce? And I would like us really to direct care workforce first to look at what are the pathways they can create for the folks that are already in the field, recognizing the skills that they already have.
So helpful, right? Because I know a big topic for a lot of people is, well, if we want to create ladders for care workers, what if we just end up creating ladders out of the care field, right? If they're not, and that might be helpful on an individual level for some individual workers, but it doesn't solve our bigger problems. Kezia, I want to give you a chance to weigh in here. What would you like to add about how workforce leaders can support the creation of care ladders that are within the caregiving field?
Thanks. This is a great question, and I'll really just kind of build on and maybe broaden from what Nicole shared, because there really is an endemic challenge in the direct care sector around the lack of professional development and career advancement opportunities for those who excel in direct care. And just to put that point in context, I really want to underscore that we need good entry-level jobs in direct care. We need to raise the floor on job quality for all direct care workers. And we do need those ladders into other professional opportunities for those who seek them, as you say. And we also need those opportunities for advancement for those who thrive in direct care roles. But as Nicole said, seek more training, new responsibilities, and the opportunity for wage progression. And so examples are like senior aide roles that really leverage and extend the unique skill set of this workforce for the benefit of workers themselves, but also long-term care consumers who are not only growing in number, but also experiencing increasingly complex conditions and diagnoses that need an enhanced level of care. So if I could just share one example, my colleagues at PHI have developed and tested an advanced role for home care workers called the Care Integration Senior Aide Role, or CISAs. And CISAs are trained and compensated to provide enhanced support for other home care workers in the field and to serve a recognized role, elevated role on the interdisciplinary care team. And in that sort of intermediary or bridging role, they're able to support the delivery of care in the field and also support more coordinated and timely responses as client care needs emerge. And we've evaluated the implementation of this role and found really promising results with regards to acceptability and impact for both clients and workers, as well as employers and payers. The problem is that although there are these innovative examples out there, there are very few recognized advanced roles at the industry or payer level. And that's where workforce development partners can play a really crucial role in helping to envision and advocate for and actualize what it will take to bring these types of innovative roles to scale. And that involves steps in collaboration with other leaders in the field, because this really does take kind of all of the expertise at the table. But thinking together about what career pathways already exist and how a new advanced role might be built in to those pathways, thinking about what the training and credentialing considerations are, identifying what funding might be leveraged to support further testing and implementation, and then working out, again, collaboratively, what would it take to scale and sustain a new career development opportunity like this.
So for those of you who are workforce leaders on this call or education leaders, you have done this with other roles and occupations in other industries. Think about how you can take what you've learned from that and apply it in this care workforce context as care workforce leaders try to formalize these senior roles. I also dropped into the chat a link to the care integration senior aid role that Kezia is talking about. That's from the PHI website, which is Kezia's organization. So Anna, I want to come back to you. You told me that one thing that stood out to you about our report was the recommendation that workforce leaders should connect with early childhood leaders in state government. What is the first step that you think a workforce leader should be taking to make connections with the ECE field? Like what is their Monday morning task that you want to give them?
Where do we start? Well, I would have to share with everyone that our local workforce board and our state workforce board has institutionalized, right? It's part of what we do. A director needs to be part of our board. And so when the director came on, we really did I think a thorough job of onboarding this person. So all workforce boards have committees. It's going back and really going, we need the voice of a director here. And when they onboard the director, again, lots of mentoring, lots of support, because it can become overwhelming to them. I also want to recognize that you being strategic. And so what we've done here in San Antonio is we have meetings with directors via Zoom, and also when the time meets them. So it's not at lunchtime, it's not in the morning. Sometimes it's after work, sometimes it's weekends. We also did some polls, but we did polls during conferences that were fun for them. So that they are having to go through all this paperwork, but just a quick poll on their phone, and they enjoyed that. And so having them at our table required us as a local workforce board to reach out to them. Our mentors making phone calls, really connecting everyone that touches the directors and the owners and hearing from them. What do you need? What do we need to do? We have what is called Alamo Quality Pathways. And so recognizing that we support them was really important. I also want to share with everyone that one of the things we've added through every one of our conferences is training is to provide them some information on legislation. So like many of your states, our state has quality standards, and many of the directors, owners thought it was being done to them. They didn't recognize that advocates had gone to Austin and fought for this. So when we really played it back to them and said stuff like, stand up if you want quality care for children, well, they all stood up. And then we went, and that's what we're doing. So it's how are we providing them the information? What's the PR we're giving them? And then how do we meet with them? And so that means we're going to need to pivot our responsibilities, right? The leaders on when's the best time to meet with them. Meeting them is really important because they're opening their centers from 6:30 to 6:30. They're exhausted. And then I want to go back to mentoring. The Alamo Quality Pathways, what we're doing here in San Antonio is really making sure that that mentor that goes to the center asks those open-ended questions. Tell me what's going on. And I love when directors go, I haven't read any of the stuff you send me. You know, I'm missing a cook. I'm missing two teachers. This is what's going on. Also, really listening to them and then going back to our state and saying, I know we wanted to do this, but what we're hearing is that we need to provide funding to our centers so that they have retention money. And boy, that helped. And the state worked with us. They were amazing, right? So listening to our directors, mentoring them, and then really modifying how are we getting the information out there and meeting their needs from conferences to training, and making it real. And I think the key is listening.
So some of you may know the actor Janet Mock talks about how we don't need role models, we need possibility models. And I feel like the workforce board in San Antonio is a possibility model that we can all be thinking of. I've put a link in the chat here to the list of folks on the board of directors, and you'll see there's a food bank represented there. There's an adult education representative on the board. Not all workforce boards are as broad-based and inclusive as what Anna is describing in San Antonio. So, I encourage you, if your workforce board isn't there yet, maybe this is a moment for some advocacy to help your workforce board get there.
Yeah.
Um,
I also want to remind everyone that's what's helped me is sitting with those people. I love when I'm sitting with executives because they're also teaching me where they're coming from business wise, right? I'm not a business person. So listening to what they need is important. They're also hearing from me. So when I say things like, have you talked to your own employees about where they're struggling with childcare? So having them come to me and going, yeah, I did what you told me. Wow. And I said, that's right. You want people to work, you want to stay open longer, and you're asking this teacher to stay till 8. Who's going to take care of her children? When is she going to take the bus home? And so that's why that's really important. And again, it's leadership, and I will give Amanda the information from our workforce board, but I want to give credit where credit is due. And I think it's having a leader that's a visionary and listens, sat down with me. I can call them and say, what's going on? And vice versa. I need to listen to them also.
That's such a great point. So we have just a couple more questions for the panel, then I'm going to open it up to the audience. So if you are thinking of a question, this is a good time to put it in the Q&A box. Nicole, I want to come back to you. You know, one thing that comes up a lot in trying to advance good care workforce policy is that we just don't have good enough data on things like workforce turnover, demographics, recruitment rates. I shared some demographics at the front end here, but I want to specify that, we don't always have turnover broken out by demographic, right? Are we losing older care workers? Are we losing, certain care workers of different demographics instead of others? Like we don't always know that. So can you talk about an opportunity for workforce leaders to advocate with state agencies to require better data collection as part of their managed care contracts? What would that look like?
So before I started working with states, I think I imagined that there was some sort of castle in every state capital that there was just it's like a big, data set, and they have access to all these things and they know everything. And there is lots of data that states have. But the truth is that in some instances, that because they are working with another provider, a managed care organization or other partners to deliver the critical services, they don't necessarily have, a firsthand reach into particular data. And so they have to work with those partners to identify, first of all, what data they are wanting, what they think they need, and would help them inform their decision making to policymakers and their administrative heads. But also, how are they going to collect that? And that requires some forethought. Managed care organizations, they have existing contracts. You can't just mid things that, oh wait, hey, I need that. It's not in the contract. And so what that requires is states working with experts like Kezia and others to say, this is what we want our data to look like, and then identifying what partners can collect that, including that in appropriate contacts. And then I think very importantly is having someone at the state level who is in charge of monitoring that data, not just saying, oh, we'll all look at it, but who is responsible for being the quarterback, ensuring that every agency is aware of what's happening and really keeping a lookout on what they need for the future. And so I think that's really key, is understanding that it's not necessarily that the states are not taking really significant action to address the direct care workforce challenges. It's that they are trying to think of what systems they need to align in order to do that. And it is a massive ship, and that doesn't turn on a dime. And so I think that really managed care organizations are critical partners in this work. And we'll see a lot of change as they become more engaged.
That is a really important point, and I hope what folks are taking away from that is not that everyone needs to become an independent PhD level data expert, but that you should be having conversations in the relationships you already have with your State Department of Labor, your State Department of Health and Human Services to say, hey, who's in charge of deciding what data requirements are in your contracts with managed care organizations? Is there a meeting? Is there a comment period where we could submit comments? And then you call up Kezia or you call up some of the other great folks on our advisory council and you say, what would you recommend? What data should we be collecting? How ought we to be looking at this, right? And I'm going to give you one quick story from some other research that NSC just did. My colleague Lindsay, who's my co-author on the report, actually was talking to a company that was having a real problem with people being late on the first shift. And they sat down and they asked their workers what was going on. And it turned out that daycare drop-off time was the exact same start time as their shift, right? And so they shifted the start time of their shift by 30 minutes, and then magically no one was late anymore because everyone had time to go drop their kids off at daycare and then come to work. That only works if your workers trust you enough to tell you the truth when you sit down and you ask that question. And there's a version of that kind of question that states and others could be looking at with data that could help us understand better. Are there leaky pipelines where people are leaving the care workforce where maybe they don't need to be if we just built in some additional flex or some support? Okay, Anna, I want to come to you now. There's a lot of folks who are probably listening to me talk saying, gosh, Amanda, this all sounds great and lovely, but I live in a state where there's really strong resistance to making public investments in workforce and education. And I can just envision myself trying to go to my state leaders and say, you should invest in this, you should support this. You're doing this in deep red Texas.
Oh,
So
yes.
what have you learned? What messages about the care workforce have you seen resonate most effectively with elected officials who might be coming to this work with a different frame of reference and a different set of assumptions?
Yeah. So the message that resonates most effectively with legislators is having a unified, consistent ask. And I will share with everyone to go with your organizations that are doing this already. So in Texas is Children at Risk, it's Texas Cares for Children, listening to where they're going, and then, you attach yourself to that voice. Also, really, looking at the state economic stability and children's health development. When we frame our messages in terms that helps policymakers understand, far-reaching investments, right, in childhood. That's the connection. But I share with everyone, find out in your state who's doing this work already. Let me reach out to them so that we're all unified and moving in that same direction. And that's where I think I want to share with all of you where we have to learn from each other and then leave our egos at the door. I mean, the credit goes to, can we help our children, our elder care, our teachers? If the answer is yes, then I don't need the credit on that. But I'm right behind you. And so for us, it's who's moving it? How do I attach myself to that movement? And if it's working for a great cause, then let's take our wins that way. And I feel that we made a huge difference this year because of that. I also want to share with you, starting really small. So we had workshops at night to teach our amazing teachers and directors and owners about advocacy. And for many of them, it's the first time they found out who was representing them. Unpacking that using free tools that the National Association for the Education of Young Children has. So let's not reinvent what's happening, and let's find out who's doing it in the state. Give them a call, tell them, add me to that cheerleader, and then follow them on that part. Because that's what we keep hearing. Is it a unified voice? If it is, then they know it's all of us doing this together.
It's like the saying goes, right? Success has 1,000 mothers and failure is an orphan. So if you want to be successful, be one of those 1,000 mothers. And I know many of you have run advocacy workshops for adult learners who want to get involved in advocating for adult education, or for job training participants who want to get involved in advocating for workforce development. So this is familiar territory for many of you listening today. Please take to heart what Anna is recommending to you, and take those ideas and run with them.
Yeah. Amanda, I also want to add to everyone that's here, at least what's happening. Also be mindful of fear. And so there are many people that are fearful to get engaged, but that doesn't mean we don't invite them to come in. And so maybe they don't want to speak up because they're afraid of their language barrier. They're afraid that they have an accent. They're afraid of their color. Say to them, just sit here and listen. Tell me what you want me to say for you. I will speak for you. So being very mindful and not judgmental of who's showing up, and why they might not be showing up.
Such a great point. I also want to draw folks' attention to another one of our absolutely amazing advisory council members in the chat. Kevin has posted a link to some of the nationally recognized work that Wisconsin is doing on this front. So I strongly encourage you all to check that out. So Kizzy, I'm going to come to you for the last question before we go to the audience, which is, we can't talk about this topic without touching on how many care workers are immigrants. We mentioned it at the front end of this webinar. There's 6 million care workforce workers. Many of them are immigrants. National Skills Coalition as an organization focuses on making sure that immigrants who are already present in the U.S. can access education and workforce opportunities on par with their U.S.-born counterparts. The environment for immigrant workers is fraught right now. A lot of our member organizations are dealing with really emotionally brutal circumstances on the ground in terms of immigration enforcement actions. What can workforce development leaders do to help communicate the important role that immigrant care workers play in our communities?
Thanks for this question, Amanda. It's so important to recognize the immigration dimension of this conversation because, as you say, the direct care workforce, or the care workforce overall, is powered in significant part by immigrants. And just to real quick put a couple of numbers on that, when we're talking about those 5.4 million direct care jobs, 28% of that workforce were born outside the United States, are immigrants. And in some states, that proportion rises to 50%, 60%, even 65% of the workforce. So immigrants fill these essential jobs. And the research shows that immigrant workers contribute uniquely to care stability, continuity, and quality. So I would say to think through what workforce leaders can do about immigration. And I really would love to also, I'm sure there's so much expertise on this call, and I would love to be able to hear from folks on the call about how to tackle this. But what I would suggest are 3 points. First of all, just sharing the message about the importance of supporting and sustaining immigrants in the direct care workforce. So in other words, or in the care workforce altogether. In other words, being part of awareness raising and narrative change. That is fundamental. And then where possible, play a role in advocating for immigration policies that enable people to keep working and contributing while staying safe with their families. So federal level advocacy is a piece of that, yes, but there are also some policy levers at the state and local levels. For example, maybe there's an opportunity to advocate for broadening state policies that govern who can apply for a driver's license, or professional licensure rules, or to advocate against implementing programs like secure communities that have been shown to have a chilling effect on labor force participation. And then thirdly, and most directly, I would encourage workforce development leaders to explore what opportunities there are within your own organizations and networks to proactively support immigrant care workers. And examples include leveraging funds to build English language classes into training programs, or even offering some of those training programs in other languages, or coordinating with other community-based organizations to facilitate access to legal aid and other supports for immigrants. developing and disseminating materials for job seekers and workers and employment and employers around immigration-related rights, responsibilities, and resources, because we all need good information from trusted sources on this topic. And then even maybe starting within your own organizations and making sure that all of your staff have access to foundational training on immigration and on cultural competence, so that everyone is a little bit more prepared to play a role in supporting all care workers, including those who are immigrants.
Really, really important points there. So we have one audience question, which I will get to. There's another one in the chat, which we'll also touch on. Anna, I'm going to come to you first, but then Nicole and Kezia, I'm going to give you a chance to chime in here because I think there are some crossover lessons that might be helpful. Before I do that, I am also just going to say, on the question of supporting immigrant care workers, some of you may be familiar with the Democracy at Work collaborative and co-op initiative. And I'm going to put into the chat a link to their website. They have created some worker co-ops in different fields. So if worker co-ops are something you're interested in a care workforce context, it is worth looking into DAWI and the work that they're doing to support immigrant workers. Okay, so the Child Development Associate, or CDA credential, is one that is often looked for in the early childhood field. But the question that we're getting here is that this credential has linguistic limitations. But we know that the early childhood field needs multilingual professionals. So how do we make a better advocacy case for linguistic inclusion within the CDA credential? Anna, I'm going to let you answer first, and then Nicole and Kezia, I'm going to come to you to talk about multilingual issues in the direct care workforce.
Yeah, we are not teaching CDA at this community college because we collaborate with the programs that are teaching it in our community. But right now, CDA, you can do this in Spanish. And so there's not a language barrier with that. I also want to share with you that one of the reasons we're not teaching it is that, like your article, it's become a pathway. So if you have your CDA, we're providing you a college credit for that CDA. And so again, it's linking all of that. So I would reach out to the council. For all of you that are here. There is avenues for that. NAYC now has most of their information in 2 or 3 languages. And so again, many of the organizations that work with teachers of young children from birth to age 8 are looking at that. I hope I answered that question.
Yeah, no, that's super helpful. And it also may be one of those things where there is some local variation in different parts of the US.
Right.
Certainly, I know that's the case for home care worker training. So let me defer to the experts here to talk a little bit about multilingualism in home care training. Kezia, I'll come to you first, and then Nicole, if you want to chime in as well.
Sure. Thank you. I appreciate broadening the question because I think it is a really important consideration in direct care and long-term care as well. And I think we need a kind of both and solution, in that we need to be thinking about ways to remove barriers to entry into training programs, competency evaluation, and direct care jobs on the basis of language. So we need to make sure that the language supports are in place, and that to the extent possible, training and evaluation can be done in multiple languages, because, as I think noted in the question, there is also a need for multilingualism in the field to meet clients where they are, and to be able to meet their linguistic needs as well as other needs. And also ensuring that care workers have the multilingualism that they need to be able to also coordinate with their home care agencies, with other members of the interdisciplinary care team, and that kind of thing. So we are seeing some good examples. Washington State is an example that has a home care certification, training and certification program in place that is offered in a whole range of the most common languages at play in the state. Some other, Wisconsin, who Kevin represents here on the call, is also doing a lot around linguistic access. So I think we have some way to go on that, but it is recognized as an issue and opportunity.
Great. Nicole, just an option if you want to chime in here.
I was going to also recognize Wisconsin for their work in the state, but I would also say that there are other some tech platforms who do training, who often partner with providers or states to deliver that, who are now also offering their training in a variety of languages. And I think that it's really critical to understand that it doesn't actually imply that someone is not fluent in English and cannot provide care across a variety of languages. But I am a terrible test taker, generally speaking. I can't imagine what that like if I spoke multiple languages. It might simply be a better representation of my learning if it was in a language that I've spoken for a longer period of time. And that's what I think is critical to recognize, is that this really is more about just opening the pathway for training and accessibility for folks who are interested in entering the field and would truly improve the quality of care available.
So we have time for one more question. I'm going to slightly reframe this one. So the question was really around how AI tools might be able to be used to help workers in learning. I guess what I want to ask for each of the three of you to tackle in the little few minutes we have left is there are inherent challenges in helping people who have direct care jobs to be able to upskill. There are only so many hours in the day. People need to work to make a living. Engaging in school or upskilling are additional hours, which are often unpaid. How do we think rigorously about when technology can help this problem and when this problem is a bigger challenge than just getting a tech tool to solve it? Because I think the answer is sometimes both, right? Sometimes technology tools can be great. But what questions should we be asking when someone comes to us to say, hey, can AI solve this problem for the care workforce? We can start with whoever wants to jump in first here.
Well, I want to take it back a step, and I would recommend that you go back to your communities and find out, are there pathways for teachers? And so what we've been working on is establishing those pathways from high school, entry level. This is where you're at, CDA, community college, all the way through. And then I'd like to share with all of you that not to fear AI, to understand what AI is doing, but to come back and recognize technology, and then recognize how can we work side by side with that person coming in utilizing AI. I mean, we're doing it right now where we tell students, show me what you've written, and they show it to me. Now let's go ahead and plug it into whatever AI you're using so that it's your words and your knowledge base. It's that side by side in helping. I know for right now, our students here, we're also doing local training with many directors, day home providers, and it's utilizing it and how it benefits them. I want to do a caveat because I had a director say to me, I don't want to touch it because what it's doing to our environment. So I would recommend to everyone. I know that I'm going through training. I don't know it all, but recognizing first, to asking someone, tell me if you're using it, and then respecting that person, like I did to that day home provider who said, I don't want to touch it. It's not helpful for the environment. I went, not a problem. Let's see what else we can do. And so recognizing how we can help our individuals side by side in your sessions, in your workshops, and in your community, but stepping back and also saying, what's our pathways? What are we doing and helping with those pathways?
All right, Nicole and Kezia, you each have about 30 seconds here if you want to hop in on this question or any facet of it.
Yeah, I would just say, as it relates to direct care workforce, we should be really focusing on improving the quality of the job for the individual. And so there's a variety of ways that we can do that, but also really ensuring that we're not emphasizing moving away from the human touch of whatever that education training is or that direct care piece of it. So we're going to be releasing a brief in the coming weeks on this topic. And Health and Human Services, they just announced a challenge grant this morning about this piece. So I'm excited to be part of the conversation going forward.
Great. Kezia?
I think I would second all of that and just sort of think about how can we use technology, AI in particular, but other technologies too, to facilitate learning, professional development, and quality jobs without seeing it as a sort of silver bullet solution, because this is ultimately about people and relationships and the direct presence of care workers.
Yeah. So Thank you all for your time in being here today. Please go back to your organizations and share this information. I hope if you've taken nothing else away from this, you have taken away the fact that there has been a conversation on these issues going on in the care workforce for well over 2 decades now about how to solve these issues. And this is a great moment to make the tent bigger and bring more workforce and education leaders into the tent. And you don't have to reinvent the wheel or start from scratch. There's a lot of wisdom already hammered out by leading folks in the field. So once again, Professor Ana de Hoyos O'Connor, Nicole Howell, Kezia Scales, we so appreciate your time and expertise today. Thank you all so much. Have a wonderful rest of your afternoon or morning.